It's just staggering how many people will be affected by back pain during the course of their lives. Dr. LaHood joins us here this morning with an urgent message to please consider a non-surgical alternative before you consider that invasive back surgery, and he's got that solution for you. From the San Diego Spine and Disc Laser Pain Center, Dr. LaHood joins us here once again. It's great to see you.
Thank you, Mark. Good morning.
Let's not overstate the case, but approximately what percentage of people will eventually have some kind of back pain?
You know, Mark, there's so many people across the county of San Diego that are going to wake up and have been waking up every day with not just back pain, but also neck pain, any type of degenerative or herniated condition that you have. If you've been diagnosed with a degenerative or herniated disc, we've got a non-surgical solution that can stop the disc from actually deteriorating.
So if deterioration is already taking place, things breaking down, it's bulging, whatever, you've got a way to deal with this non-surgically. Now, folks, if that's interesting to you, please, we're going to put a number up on the screen there. You can start calling right now for a free exam, 2 free treatments. Completely free, no obligation. This is just so you can experience this and see if you get some relief from this. And a huge percentage of folks do just after 1 treatment, but you'll offer them 2 free ones.
That's correct. You know, there's a study out of the University of Toronto that says that Americans are 50% worse than they are this year than we were 10 years ago. If you've been going through and getting epidural injections into your neck or into your back to stop the pain, if you've been taking prescription medications, listen, Mark, we have a solution. This is not just an aging process that's occurring to the disc. Degenerative disc is a very serious condition that will progressively get worse. Using our decompression systems, we can rehydrate that disc tissue and stop the collapse of the actual joint onto the nerve.
Now, I know we can show folks graphically, and we're doing that right now, what this looks like. It's called spinal decompression. And by creating a vacuum here, by actually putting some reverse pressure on the spine, you actually get that disc to retract, and it draws fluid in at the same time.
It's much more powerful than doing core strengthening exercises or using a type of inversion table. This is a controlled axial stretch that pulls the disc back into a neutral position, and it really rehydrates that tissue, and that's really the key, is to get the joint to stabilize, to stop that crushing pressure on the spine.
Now, the decompression process is so simple and relaxing here. I've been in there and I've watched folks doze and fall asleep during, and I went through it one time just to try it out, and again, it felt great. It was so relaxing, it was almost comical. It's like, wow, this is doing me good and it feels good.
You know, as opposed to having an invasive surgery, and you don't have any of the complications that go with an invasive technique. This is all non-invasive. We use the decompression to unload the spinal joint, and then we use this deep tissue class 4 laser to basically reduce the swelling that has built up cumulatively around the joint.
Now, let's explain the laser. It is not hot. You feel a warm sensation, that's it. That red dot always kind of fools people, and they hear laser and they think there's some kind of cutting going on. It's just to stimulate healing.
That's exactly right. It's stimulating those damaged cells in the disc. So if you have a torn disc, a herniated disc, if you have a referral of pain going into your arm or leg like a sciatic pain, this laser treatment will help seal up the disc again. So after we're rehydrating it, you have major benefit of tissue healing.
So folks, again, totally free and without obligation whatsoever, an exam and 2 free decompression and laser treatments. Okay, it's completely free. So can folks call even if it's not for them, like for a loved one or something, as long as they make sure they get them there for the appointment?
Absolutely.
Okay, so folks, you're free to do that too. Maybe it's it's a spouse that keeps saying, "Oh, my back hurts," but and they refuse to do anything about it.
So we'll do a full comprehensive history. We'll do a complimentary exam and 2 free decompression and laser treatments to see if you're a good candidate. I'll be able to tell within those visits if you qualify for care.
Okay, so again, folks, it's no obligation whatsoever. They're going to be real honest with you, but about what percentage of people would you say roughly you are able to help?
You know, every day we have patients coming up to us just thanking us for the amount of pain that's been reduced. They're getting back to their normal life of golfing, walking. It's about 80 to 90% success rate at the clinic.
And again, at absolutely no risk to you whatsoever. So why not check out a non-surgical approach? The surgical approach will always be there for you, folks, but there's no reason you have to rush into it. unless this particular method just doesn't help. And you'll know that absolutely for free. Won't cost you a thing. Dr. Nicholas LaHood, it's great to see you. San Diego Spine and Disc Laser Pain Center. Give them a call. The phone lines are still open. First 25 callers, absolutely free exam and 2 free treatments, the laser and the decompression. Thank you, sir.
Thank you.